5 tips for OKC home healthcare patient data security.
Courtesy of EMSCO Solutions, Information Technology Guide for Oklahoma City Home Healthcare Organizations.
With new technology allowing ease of access and documentation of patient care, patient data security has become more strictly regulated by HIPAA and other organizations. Home healthcare organizations in Oklahoma City are taking necessary measures to ensure safety and security of their patients' protected health information, or PHI. Below are 5 tips that can be utilized to manage and maintain patient data security, preventing breaches. Number 1. Promote a culture focused on data security. In the financial industry, the price of ignoring regulations for securing data is greatly understood. Healthcare organizations need to be just as vigilant in steps to maintain a level of security that is similar to the financial industry. Leaders of healthcare companies need to promote a culture that focuses on securing PHI. Number 2. Conduct risk assessments of PHI. Due to the rapid deployment and use of electronic health records, healthcare organizations have become vulnerable to security breaches. The use of electronic documents has significantly improved the quality of patient care. However, organizations need to assess databases to be sure they do not lack essential security features. Number 3. Conduct testing on a regular basis to monitor the ability to penetrate security features. Testing on a regular basis can help determine just how secure your organization's database is or is not. The tests should include network security. This is because weak network security is one of the leading ways hackers gain access to PHI. Evaluate firewall strength also. Any weaknesses identified in the security system can be corrected immediately before a security breach occurs. Number 4. Put a strict data access model in force. Identify healthcare staff that are allowed access to certain information and limit the access to protected devices only. A model such as this within a healthcare organization needs to identify what can be sent to particular devices and restrict access to data that is only meant to be viewed by certain professionals. By tracking this data, an organization can prevent PHI from being accessed by unauthorized users. Number 5. Develop plans to impede and overcome patient data security breaches. This should be a top priority in a healthcare organization and include the assignment of staff to manage regular security tests and enforce the model for data access. Clearly outline steps that are to be taken to survive security breaches and ways in which to make adjustments to the data access model. How to handle a breach in security. Following the security plan should be a healthcare organization's first step. Leaders in the organization should also have a disaster recovery plan prepared and reference it to minimize the amount of damage. Once the information compromised is identified, the data should be isolated and affected patients should be notified. Making necessary changes in your data security to prevent future breaches should be the next priority and should include testing the network security. Bottom line. Breaches of patient data security are not only costly to a healthcare organization, but also have an adverse impact on patients. Securing PHI in an electronic record should be the priority for any healthcare organization. With the new waves of technology that are used by healthcare professionals to view, send, and store patient data, it is imperative to follow guidelines to safeguard this sensitive information. What other steps should be considered when maintaining patient data security? Let us know your thoughts in the comments box below. And to follow up on the tips introduced in this article, be sure to download your free Information Technology Guide for Oklahoma City Home Healthcare Organizations.
You can download a copy of this guide while it's still available at okchomehealthitguide.com. Thanks so much for stopping by and tuning in today to learn all about
5 tips for OKC home healthcare patient data security.